Last year, President Bush appointed me to the board of directors of the Millennium Challenge Corporation, also known as the MCC. This agency was created by Congress in 2003 when I was Majority Leader of the United States Senate. The MCC represents a fundamentally different way of giving American development aid to the world's most deserving nations.
I had the pleasure of meeting the President, and we had a superb discussion, a thorough discussion about the progress that's being made on the Millennium Challenge Corporation, the MCA Mozambique, where we've had great progress.
The goal of the MCA in the United States is to work closely with other countries to fight poverty through sustained economic development. The program in Mozambique is a program of and by the people of Mozambique, not the United States. It is $500 million, a very large sum. Your President, Mr. Minister, through you as Minister, demonstrated the commitment to a program that will indeed be successful in fighting poverty and at the same time insisting upon accountability every step along the way.
Okay.
I'm here in Maputo to learn about the importance of having clean water and good sanitation. Now, I want all of you to tell me what the number one thing that you need is.
Qual é a primeira coisa que precisam nesta zona?
Aqua? I want you to tell me about it today.
Yes. Yes.
Okay. This is about as graphic an illustration as you can see to the problems with sanitation. Behind me is a road in Mahaviti, a community right outside Nampala. And you can see the drainage, the sewage coming in from the local houses. A local clinic, a hospital clinic just up the way, draining its sewage into what becomes, I was told just a couple of hours ago, a watering hole with scores and scores of people around getting their drinking water from this obviously filthy water. The MCC is going to address this. Millennium Challenge Corporation has a plan, and that plan today is to come in and put adequate drainage in here so that this community will not be exposed to the dirt, to the grime, to the infection that you see here today. All right, now tell me what we're going to see.
Right, this is a community where we have more or less 200 household connections. It's a small community and we have 2 standpipes. These have been recently implemented, so it's a very recent investment.
Right.
And we've managed to cover all the area, 100% of the area, within a couple of months. Now, these people used to pay water. It's a very, very expensive water because they didn't have an alternative for water. The underground water is not good for human consumption. So there was some people that came with trucks and they used to sell water, very expensive.
Oh, really?
They had to pay very expensive water. Now they are paying much less, and they have the facility to have water at their households. This was an area where there was big cholera problems.
Cholera, yeah?
Yes, cholera was a big problem here, and now it's almost vanished. So there is no cholera problem.
Isn't that amazing?
Because everybody can have good water. So she used to spend about 2 hours to get water every day. Now she has water in their house.
So you used to have to go 2 hours?
2 hours, yeah, to get water. It was very far and it was not quality water. She used to buy, to get it from a hole.
Yeah.
Now she's very happy because she has a yard tap. The most important thing is that she has now quality water.
This makes the difference in saving people's lives. Over 1.2 billion people in the world don't have access to clean water. Right now, in this household, this family can avoid cholera, can avoid the bacterial diseases by having access to this clean water. It's what matters. In well-governed countries, American generosity can produce transformational change in the daily lives of poor people. The MCC model even produces change before any money is spent. We're finding that governments are undertaking important reforms in an effort to qualify for MCC assistance. The MCC effect, as we call it, is the best bargain in foreign aid. Our very special journey continues. For the past 10 years, I have been on the ground, in clinics, in hospitals, delivering care as a physician. I've seen how HIV/AIDS and malaria and tuberculosis are ravaging societies, hollowing out those societies. I've been able to operate in the southern Sudan, in the Nuba Mountains in the middle of Sudan, in southwest Kenya, in Maputo, Mozambique, and I've seen the range of what is needed. What the American people need to know is that their dollars are making a difference in reversing the course of HIV/AIDS and malaria and tuberculosis. Today, we will journey to Maputo Central Hospital, a referral center for about 4 million people who come who otherwise would see no health care. I'll be participating in an operation for a complication of tuberculosis, a disease which kills about 2 million people a year, a disease we can prevent and a disease we can treat. Today I'm operating with Dr. Itilio here at Maputo General Hospital. The patient is a 60-year-old man who's had a 4-year history of fevers and night sweats, but what he has now is a huge lung infection as a complication of one of the most common diseases right here, not only in Maputo, but throughout the continent of Africa, tuberculosis. Our plans will be to take out that entire right lung, staying out of the field of the infection and closing off the leakage from the windpipe. Tuberculosis kills about 2 million people a year, and malaria 1 million a year. Tuberculosis is rapidly increasing around the world, in large part because of the HIV/AIDS infections that we are seeing. Today's patient has a complication of a tuberculosis infection, an infection that we probably wouldn't have seen 15 years ago, but because this patient has HIV/AIDS, we've seen an explosion in that infection. I wanted to come out for a second and let you know the patient is doing very well. We've just taken out the right lung, the infected lung, and then we're going to go after the source of the infection. There are approximately 2.5 million people that die of HIV/AIDS every year. In all likelihood, another 20, 30, or even 40 million people will die. There are 28,000 children who are going to die over the next 24 hours, most of them in Africa, in this part of the world. The good news is it doesn't take heart transplantation to cure them, to treat them, to prevent those deaths. Indeed, 2/3 of those 28,000 deaths over the next 24 hours can be prevented by simple things like clean water, like vitamin A, like vaccines. These are cheap, they're inexpensive, and we know that they work.